because we've all often had to fight to make sure that those resources were comparable to what we see even on this peninsula, from west to east. So you have a vaccination site that the assembly member, your city councilwoman, your state senator, your congressperson fought so diligently for, but yet we're having this conversation. For those of you who are up against the wall and debating whether the vaccine is effective or not, this vaccine is effective. It's been shown, and we'll hear from, I don't want you to take my word from it. I want you to hear from our respective leaders in the health department. Far Rockaway, Edgemere, our rates are hovering under 40%. We're at about 38% vaccination rate. It's shameful. It's here. The vaccines are in your backyard. Take advantage of it. I was going to give a very diplomatic speech this morning, but I can't, because you are putting people's lives at risk by not getting the vaccine. We don't want to hear that, oh, I had it already, so therefore, I have the antibodies, I'm fine. No, get the vaccine. This is a matter of life and death. We lost people in the buildings across the street. We lost people in this neighborhood. Now is the time to stop playing cute. It is not time to party like it's 1999. We can party like it's 1999 when you have your vaccine. So I'm glad to be joined by many leaders. I'm going to start with my neighbor. We often sort of compare ourselves to kings and queens because he represents the county of Kings and I represent the county of Queens. But I give you our Brooklyn Borough president, who was out here. Let me remind you, when we couldn't get masks, Eric reached out to me. I was not even the borough president. And I was a council member representing this district, and he brought thousands upon thousands of masks into this community to ensure that the folks here could have as much protection as possible. So I'm thankful to have him here, not only in his capacity as Brooklyn Borough President, but our future mayor of the city of New York, who will stand firmly to making sure that equity and justice is rooted in our healthcare system and all we do. So it brings me a pleasure, honor to bring up Eric Adams.
Thank you, Borough President, and really this amazing team of elected officials, the assemblymen, the councilmen, Senator Sanders. I know that he was also going to be coming by, and some of the other electeds, as we mobilize together to deal with this new variant. And as we evolve into what the new mandates are going to be for restaurants, for concerts, for events, this is a very complicated moment at this point of dealing with this virus. COVID is a formidable opponent. I've stated this over and over again, and we cannot remain rigid in our approach to COVID. We must pivot and protect as COVID continues to pivot and response. And so when you look at the numbers here in this zip code, the councilwoman, and the other electeds, our assemblymen, how they have fought to make sure that we can have not only stationary locations like we have here, but also the mobile locations. They have been extremely creative of saying, let's meet people where they are, and so that we can remove the barriers that are preventing people from receiving their vaccine, because you have to remove those barriers. We don't want people to say, listen, I don't have the Metro card to swipe to go to a location, so let's move the van to you. But when you look at the numbers, as the borough president stated, we are here with below 40%. Citywide, in the cities over 60%, Queens is even over 60%. But when you look at the pockets, particularly in black and brown communities, you're looking at below the citywide numbers. You get vaccinated, the science is showing that your recovery is better, you're not hit with a more severe outcome. The numbers are clear. And so we have to put away all of the pre-existing fears that we've had around the history of vaccines, the history of people of mistrust around having vaccinations. It is time for us to mobilize together, and I think the borough president said it clear that we can't be selfish at this moment. It's about our families, our friends, those frontline workers. We must really get the message out about vaccinations and getting vaccines. I got my shot. I'm out often. It is imperative that we get others to really mobilize in this place, and that's why we're here together. The health establishment, local community leaders, clergy, faith-based institutions, elected officials, we're coming together. We're going to do a series of things over the last few weeks. We're back handing out masks. We're going to go to several locations and hand out masks to people as a reminder. Hats off to the city with the new initiative that they're looking to do. We're giving $100 to a local business in the bids or to refer people. I think that's a smart way to do it. Let's incentivize whatever we need to do to get people to take that shot so they can have a good shot of surviving COVID-19. We can't go back to the days when trailers were filled with bodies on top of bodies. I remember those days, and it was one of the most traumatic experiences. I was here during 9/11. I responded to scenes where a large number of people lost their lives. I've been a part of some of the most horrific experience as a law enforcement officer. But trust me, what I witnessed during COVID was in no comparison to the traumatization that people were experiencing. Dropping their loved ones off to hospitals, never to see them again. Having them buried on an island somewhere in our city. Not being able to go inside the hospital and watch them. We're still reliving that impact. Children not being able to go to school, the socialization and how it impacted them. We can't go backwards to New York. We have to vaccinate. And so thank everyone that's here for being a part of this coalition of stated we can do this together. We're going to boost these numbers up. And all the volunteers and employees who are here, hats off to you. And this is a great site here in Rockaway, and let's continue to meet people where they are so we can give them that shot in the arm to give them a shot to prevent the spread of COVID-19 in our city. Again, thank you so much, Borough President.
Thank you, fellow VP. Next, we're going to hear from the first Deputy Commissioner of the Department of Health, the Chief Equity Officer. And he's done a lot of great work with us, and it was alluded to by Eric for a minute that Queens County was the first county in the state to hit 1 million vaccines. And as Eric alluded to, there are many pockets that still lag behind, although we were proud to hit that millionth mark. And this commissioner has been, I want to give my hats off to him, has been on the front lines, talking to communities of color. We've probably done about 1,000 Zooms when we couldn't meet in person. And I want to thank him for his leadership at the Department of Health and Mental Hygiene. It brings me great honor to bring up Dr. Torian Easterling.
This is a challenging moment, and we have a lot of work to do, but we also have things to stand on that we can be proud of. So certainly want to thank the Borough President for his leadership, thank all of the community leaders who are standing behind me, all of the elected officials who are here. The reality is we're here in the Borough Rockaways because we know the challenges we've been facing these past year and a half. As you've already heard, this has been the epicenter of the epidemic, of this pandemic. And the work that we've had to do is really communicate clearly how we have to work collectively to get the information out, the message of how we keep folks safe, families together, and to some degree, we have failed at that. And we have something at our disposal that can really protect our communities and protect our families. We have talked about the way forward to recovery, a just recovery. The way forward for a just recovery is with the vaccine. And so, as you've already heard from both borough presidents, we have to get the message out that the vaccines are safe, that they are effective, that they are saving many, many lives. Over 10 million doses have already been administered in this city. 10 million. And we have to acknowledge that achievement, that milestone, but we know that we have more work to do. The work that you have seen across this city of increasing access in communities across New York City to ensure that every New Yorker has access to this vaccine. The infrastructure of making sure that we can virtually say that every New Yorker lives within a mile of a vaccine site. And so that includes a site that we're at right now, like the city-run site, pharmacy, a provider, but also our healthcare systems. And we've also made sure that our in-home vaccine program is available to anyone that is eligible for a vaccine. Those are great achievements. And so now we have to make sure that the access is matched with the demand. We have to ensure that individuals are ready to take the vaccine. So what does that entail? And you've already heard the borough president talked about the countless town halls, the countless engagements, and I want to tip my hat off to all of the canvassers who are going door to door, speaking with people, answering their questions. The questions that I hear quite often, time and time again. I'm a family doctor. I see children, I see adults who are asking questions about the timeliness of the vaccine, about safety, about side effects of the vaccines, and those are most of the questions that we receive. People know that these vaccines are safe, but they want to make sure that they're going to protect them, but also not experience all of the side effects. So you're already seeing so many people who have been vaccinated, like myself, the borough presidents have already talked about being vaccinated. We're standing here, men of color who have already been vaccinated, alive and well. True testament that the vaccines are safe, and so many others across our communities who've already been vaccinated. And so that we have to be ready to tell our story. So I ask all of you, leave here and share your story if you've already been vaccinated. Let your family member, let your friends know that these vaccines are safe. We need your voice. The most important and single important factor that we've heard is that a conversation that you have that have encouraged someone else has really helped turn the tide of someone getting vaccinated. Yes, we're going to continue to do all we can. We're going to increase access. We're going to continue to incentivize individuals. All these things that we know that are necessary. You've already heard alluded to the mandates that we have in place. But I ask that if you've already been vaccinated, that you share your story. That one-on-one conversation, whether you're in a mosque, whether you're in a temple or a church, whether you're in your community center, tell your story. You will help someone else, encourage them to get vaccinated, and it's so important. And as we get ready to go back to school, we are quickly approaching the last day. That a child will be ready to be fully vaccinated at the time of the first day of school. So I ask the parents, speak to their pediatricians, to your providers, to your friends. Help your child that is 12 and older make sure that they get their Pfizer vaccine. This is going to be so important. But just because we're asking about August 9th is that date, last day before a child could be fully vaccinated in time for the first day of school. That's not the only day. And so August 9th, we want to make sure all of our children are vaccinated that are eligible, but you can go at any time. So I just want to thank you all for the partnership, all the community leaders, the elected officials, for the work that you're doing to make sure that we're protecting our city, protecting our communities, and we have to keep this going. Thank you so much.
Thank you. Thank you, Dr. I want to acknowledge we've been joined by staff members from Assemblymember Stacey Pepper Model's office, Councilmember Eric Ulrich. We're also joined by Alyssa Brown, PhD, founder and executive director of Child Health Partnership, professor of psychology from St. John's University. Sarah Durrani, associate director of sales, Metro Plus Health Queens. Moshe Brandishaw, executive director of the JCCRP. Hope I said your last name.
Okay.
Rosalind Mason, Rock Safe Streets, Jonathan Gaffney, Ocean Bay CDC, Reverend Gray, Macedonia Baptist Church. I know we've been joined by Valerie West from District Leader, Kevin Alexander, RDRC, Jonathan Gasca, and Reverend Mullins representing Challenge Prep Academy. We also are joined by both leaders of our healthcare institutions here, and I'll allow them to say some words later on if they wish. Renee Hastig-Moats, Vice President of External Affairs at St. John's Hospital, and Dr. Miriam Vega of the Joseph P. Adabo Health Center as well. Next, we'll hear from our Bronx Deputy Borough President, because the BPs have all collectively come together to work together borough citywide to make sure we're getting this message out, and we'll be launching and really doing some initiatives over the course of the next few weeks to get as many people vaxxed, especially in light of the school year starting. We now are joined by our Bronx Deputy Borough President, Marika Scott McFadden.
Thank you so much. Thank you, Borough President Richards and Borough President Adams. It's wonderful to be here on behalf of Borough President Ruben Diaz Jr. We've had disparities in our communities, and in the Bronx we've lost many lives. So we know that it's very important to come together at a time like this, to work together, to put our joint office, the force of our joint offices together in order to bring continued services to our communities that need it so very much. I can speak personally as a mother, as a woman of color who has, I've been vaccinated, and I speak and preach, as they would say, to everyone that I meet, that this is how we get to the other side of the pandemic, that how our communities will continue to thrive if we can go ahead and put all of our issues aside and work toward putting together a terrific response and getting out, talking to our neighbors, talking to all of the folks that really are hesitant, and letting them know that this is the way to go. And I thank everyone here, of the elected officials that represent this area, and also the community leaders who are here to do just that, to put our forces together, to work together, because we know that is sincerely the only way that we're going to get through this. We have to think about each other, we have to work with each other, and we have to take the vaccine to help not just ourselves, but everyone else that's in the fight. So I thank you for having me here today to be a part of this powerhouse of an initiative to bring better outcomes to our respective communities. Thank you so much.